Attention people of the United States, you are being scammed by the government.
I'm Delaney.
I'm Jordan.
And I'm Natalia.
And you're watching America's favorite news station.
Tonight's newscast is a public service announcement about our nation's healthcare. To give a little background information, healthcare was first talked about in World War I, but not put into action until World War II, when President Roosevelt decided to freeze labor wages and allow employers to offer health benefits to employees instead.
What we have had up to this point is the Affordable Care Act, enacted in 2010, which allows for bigger federal benefits for healthcare. Because of this act, 20 million more people now have healthcare, and it allows for people to be more economically equal, financially stable, have a lower federal deficit, and for healthcare to be more comprehensive.
But on the other hand, some critics say that healthcare is too expensive and sometimes too complex for some Americans to understand. As you can see, healthcare is currently very expensive. Over the last 20 years, healthcare has increased by over $930 billion.
The sources for healthcare funding include private insurances, Medicare, Medicaid, and other public services.
This means that the nation's healthcare funding ultimately comes from taxes and insurance premiums that we pay out of pocket.
You guys, did you know 29% of Americans have trouble paying for their medical bills and in turn have to cut back on spending on their food, water, and other basic necessities? It's crazy.
Yeah, it is, especially considering compared to 11 other industrialized countries that we're ranked the worst healthcare quality.
That means we're spending the most amount of money for the lowest quality healthcare.
Crazy.
So with the new Republican tax plan, this will lead to less coverage for poor adults as well as businesses, doctors, hospitals, and elderly people.
The new Republican tax plan also takes away the individual mandate, which had required all Americans to purchase some level of insurance, and then if they didn't purchase it, they would receive a penalty tax. Now this is all being taken away, which also means a lower enrollment. And for people that could not afford health care, there used to be government subsidies, and this will not be funded as much anymore. As you can see from these two graphs from theatlantic.com, the United States spends 17.7% of their GDP on healthcare funding, which is exponentially higher than the other countries that are similarly industrialized, such as France and Australia.
You can also see that America receives the lowest quality healthcare compared to the other countries. What other countries have done to improve their care quality is provided universal coverage for everyone, so this ensures that everyone has access to some form of healthcare.
An individual American's healthcare depends on things such as their age, their gender, their disabilities, or their previous conditions, and that depends the price of their care. Some Americans' care costs are extremely expensive, which means they have to cut back on spending on other things, which causes less money circulating in the economy in general.
When analyzing healthcare spending, it's interesting to actually take a look at the statistics between different groups of who spends more. 56% of total healthcare spending was done by females, so that's a little bit of an overall statistic. But when you're looking at specifically children, per capita spending for male children was actually 3% higher than females. And then when you're looking at adults under 45, the main group, per capita spending was actually 70% more for females than it was for males, which is a really big gap compared to all the other age groups. For elders, females spent 9% more on healthcare than males. So it's interesting to look at the difference between females and males and see that that actually does have a pretty big difference, especially when you're looking at adults.
Let's go to some live footage of a lady in a car crash.
Excuse me, miss. Here, let me help you to the ambulance.
Thank you.
Oh, wait, do you have health care?
I do not.
Oh, sorry, that sucks. So how much do you think America spends a year on healthcare funding?
$50,000.
1 cent. 25 million. What is 4 billion?
1 billion.
3.8 billion.
Oh gosh. Probably 101 million. 4 million.
I think like 75 million.
What if I told you they spent $3.2 trillion in 2015?
That's a lot of money.
It is a lot of money. And that's 17.8% of our GDP.
Dang, that's crazy.
That's a lot of money. That's a lot.
Gosh, that's a lot.
Yeah.
Wow. That's crazy.
Yeah. On healthcare.
Do we have that much money?
A lot of money.
We don't. I'm pretty sure the U.S. is in debt.
I'm Natalia. Talia.
And I'm Jordan.
And thank you for watching America's favorite news station.
Thank you for watching tonight's newscast. We hope that you take all of this information into account and understand that taking away our universal health care will have negative effects on our economy.